Eskamani, you're recognized in debate.
Thank you so much, Chair. Representative Snyder, this is a very scary policy proposal, and it's legislation that really is campaign rhetoric masqueraded into a bill. Once again, members, we have legislation that is performative in nature. It's not actually governing. And as we noted several times in debate, these protections are already available under federal law, but this expands the scope purely for political gain. Now, I wasn't elected to restrict access to care, but I was elected to unpack the facts. So first, this bill is subjective, and you said it yourself. The bill is so broad that you can make up a reason under whatever standards of morality that you want. And ethics and morality can also shift with time. So you are providing an outlet for people to switch and choose, decide what service they want to provide based on what their personal preferences, or worse, the political climate. Consumers don't always have options. I appreciate the representative in this committee making a point that you can just shop around for providers. Unfortunately, that is a option that not every Floridian has. If you live in a rural community, if you live in an area where the majority of your hospitals are faith-based, you don't have options to shop around. And if you're a Medicaid patient, we don't even have enough Medicaid providers in the state due to the low reimbursement rate. So this is not a realistic option to say you can shop around for the best doctor. Unfortunately, not every consumer and patient has that option. And you keep saying this is not patient-based, but a person's identity can also impact what health services they need. We already heard from leaders in the HIV advocacy community and HIV services. LGBTQ plus people may also need services that revolve around HIV care. They may also need services around PrEP and PEP. The fact that you are empowering people to reject services because of who you love is dangerous. And it is a slippery slope that opens up the gate to other types of rejections. You know, I brought up points about Trump supporters. I heard some, laughing or comments in the audience. I bring up those examples because they're legitimate. You have people who do not want to get the vaccine, who are going to doctors to seek alternatives like ivermectin. Your policy could also allow a provider to reject that based on them not wanting to provide a service. So this goes both ways, which is dangerous to every Floridian because you're taking away the freedom of patients to access a service that they feel like is right for them. And finally, this bill allows any employee of a healthcare institution or payer, including technicians and those who perform ministerial tasks, to deny care when they have a personal objection to service. And the bill absolves those refusing care of all criminal, administrative, or civil liability, even if a patient is harmed. I have no idea how that is acceptable. And the last point I'll make is that a sexual assault survivor might need access to emergency contraception. And this bill would allow a provider without any type of liability to refuse access to emergency contraception for a survivor of rape. Think about that. This bill goes far beyond existing law and allows refusals for any type of health service for any reason. It is performative, it is political, and it's canceling people because of who they are. And I urge all of my colleagues to vote no.
Representative